Dr. Perrin, I'm really sorry. I know I told you I wouldn't ask anymore, but I really need an early refill.
For the narcotic pain medicines?
Yes, yeah, the pain is really great.
You know, Karen, I'm really sorry, but as you agreed before, we'd have a policy of no more early refills on prescription pain medicines.
But Dr. Perrin, you've helped me before.
I know, and
We have a partnership.
we do, and I really still want to work together with you to try to solve these problems. But I took a look at the pharmacy monitoring report, and it's been our mistake for not having checked that as carefully as we should have. And there's actually 2 other medical offices that you've gotten some controlled drugs from. You know, one was some sleeping pills, another was a nerve pill from a psychiatrist, and one urgent care or emergency room where you got some more of the narcotic pain medicines. In addition, the last toxicology screen, which I didn't really know how to tell you about, but it was positive for marijuana and for an amphetamine-like substance, which we don't know for sure, but might be methamphetamine.
I'm not a drug addict. Are you calling me a drug addict?
No, Karen, I'm certainly not calling you anything, and I'm certainly not calling you a drug addict. What I'm saying is that you have a substance use disorder, a problem with your use of substances, and chronic pain. When a doctor is treating a patient for high blood pressure, they may treat them one way. If they suddenly realize the patient has high blood pressure plus diabetes, that requires a change in the treatment of the high blood pressure because of the extra diagnosis. I thought you had a chronic pain problem with your back, and that's all. Now that I know you have a second diagnosis, a substance use disorder, that requires us to change the way we treat your pain. And it requires us to stop prescribing any kind of narcotic pain reliever. So it's just not safe
Labs
for me
can
to
make
prescribe.
mistakes.
Labs can make mistakes, but what we have here is a pattern of requests for early refills, going to some other prescribers, even though you agreed in your informed consent form that you would only get controlled drug prescriptions from us,
You might have been out of town.
and a toxicology screen that's positive for substances that make this dangerous. It's nothing about you, it's about your safety. And it's unsafe for us to continue on narcotic pain medicine, so I have to stop prescribing. I just must.
Then why did you start me in the first place? You told me it would help me.
I thought you had one diagnosis, a really bad back. Now I know you have 2 diagnoses, a really bad back and a substance abuse problem. And now that I know you have a substance abuse problem, which I didn't know before, it's no longer safe to prescribe any potentially abusable medicines.
Maybe it's in my best interest to get a second opinion.
It's absolutely your right to get an opinion from anyone you want, but we want to continue to work with you. I know now that you have 2 diagnoses. I know that the treatment we've been doing up until now is not the right one. And I don't want you sick in terms of withdrawal, but we must have you safe. And so I'm not allowed to write for any more controlled drugs. But I still definitely want to care for you. You still have a real pain problem.
So what do I do now when I walk out of here and I'm in pain and I have no pills? How is that helping me?
We have a few possibilities right now. I can refer you to a medical withdrawal unit, and they can help get you off these medications. I can refer you to a buprenorphine prescriber who will provide you buprenorphine for your substance use disorder, and it'll also help some for the pain. And then we can continue together with a biobehavioral approach to your pain. Or I can refer you to a methadone program where they will give you methadone for your substance use disorder, and it'll help with your pain, and continue here with a biobehavioral approach. What I can't do is pretend like I don't know that you have a substance use disorder now and just keep prescribing. I'm not allowed. It's just not safe. Which do you feel comfortable trying?
I hear what you're telling me. I'm not happy.
Yeah.
And if in fact you're right, which I don't think you are, about me having a substance abuse problem, I'm going to call you. And I'm going to let you know if I show any signs of withdrawals. And you're going to have to be ready to hear it.
If you have any symptoms of withdrawal, we want to see you in the office or be paged by the emergency room if you go to an emergency room off hours. We don't want you sick, but we must have you safe, and continuing to prescribe is not safe. So that sounds like a plan.
You know, I've tried multiple things before. And you know that.
Yeah.
You've been my doctor a long time. But once you gave me the opioids, I was able to start rejoining life again.
Well, when a person has a substance use disorder and it's active, like yours is, it sabotages all of the biobehavioral interventions. Nothing seems to work for the pain other than the pills. And then
That's
the
right.
person needs more and more and more pills, which is why you've come for the early refills and you've gone to the other providers and even had the problems with your toxicology testing. So when a substance use disorder is active, it sabotages the possibility of anything else being effective. Now that we know you have a substance use disorder and we can work together to get you into recovery from the substance use disorder, you can and will get better from a pain management standpoint, because then the biobehavioral model will absolutely work.
We'll see.
We sure will.